Welcome everyone. Welcome to the second installment of this Fair Coffee lecture this year. When we were planning all these lectures, we were sort of hoping, debating whether we would need to organize this already in person. Questions like what type of coffee are we going to serve, and maybe we could do a Friday afternoon fair beer lecture, but I think we're stuck to this format for a while. So who are we? Who is organizing these Fair Coffee lectures? Me and Danny are from the Open Science community of Maastricht. And there's Erik, Olaf, Carlos, Maria, and Seychella are from the CDDI / Data Hub. And we have a new member who would like to, who joined us, would like to present. It's Pedro from the library. Welcome, Pedro. Pedro is going to do the quiz today. The program for our Fair Coffee lecture of today is first we're going to do a very short introduction on FAIR. Then our speaker of today, Ronald Cornet, is going to give his lecture from FAIR principles via, let's see, via
practices to profits.
That was the word, sorry, Ronald. Via practices to profits. And then at the end, as usual, a quiz. Let's see, a short introduction. I think FAIR, if we look at FAIR, everyone knows the acronym. And we all know that FAIR is about the metadata, rich metadata, the findability, the identifiers, the communication protocols for the accessibility, the vocabularies in the interoperability, and the community standards and licenses in the reproducibility. But what it's also very good to mention, and especially with regards to health data, is that we also need machine actionability. That's also one of the main focuses of FAIR, to make the data machine actionable. Why? There's so much data, there's so much health data. There's 2,314 exabytes in 2020. And if you're questioning if you have a question, what is an exabyte? That's a gigabyte with 9 zeros. Health data is growing more quickly than media and entertainment data. It's growing at a rate of 36% annually. So if we want to be able to analyze that data, then we need data science, and we need data that is machine actionable. So that's what I think in health data, one of the main reasons why we need to make sure that we make our data fair. Now, what does this mean in practice? There are diseases that a specialist might see only once in his career, in his whole career. If we want to help them with diagnosing rare diseases, then we have to create data that is interoperable, that is fair, and so that we can help clinicians make diagnosis of rare diseases. So that's a very quick introduction into FAIR. The speaker of today, Dr. Ronald Cornet, will present his lecture. I will unshare my screen so you can start sharing.
Thanks all for joining in this session, and thanks to the organizers for having me. I think it's a great opportunity to get together as maybe largely people from or working in or from the Netherlands. I don't know what exactly the geographic scope of the audience is. Of course, being online, we can come basically from anywhere. And it's great that we can have this exchange of thoughts in this presentation. Thinking about today, I thought it was actually feeling to me like 25 years of coffee. So when I moved to Amsterdam, I worked in Rotterdam a couple of years, and in Rotterdam I got my feet wet in Java, and then I moved to Amsterdam and worked more on that. So the former Java logo looks very much like the Fair Coffee logo, only that I think a small cloud of words has been added to the coffee. So, well, I prefer my coffee black rather than red and blue or with letter vermicelli in it. But I think, well, we definitely needed a lot of coffee to get from where we started 25 years ago and where we are today. And I think it's great that also with all the work happening now in the fair community, that we're actually making progress and are really establishing a possibility of collaborative data analysis. And seeing where we were 25 years ago, where you had to put all the pieces together yourself, I think contemporary standards enormously helped us in doing all the things that we're doing. So briefly about me, I'm an associate professor and principal investigator at Amsterdam University Medical Centers within the Amsterdam Public Health Research Institute at the Department of Medical Informatics. So my role is basically research and teaching. We have a bachelor's program in medical informatics, a master's program in medical informatics, and also a master program in health informatics, which is geared towards healthcare professionals. And in all of these programs, there is a part focusing on topics like knowledge representation, ontology auditing, SNOMED CT, fair data, and natural language processing, largely to get from unstructured data to structured and interoperable data. Some other hats that I wear occasionally are those of being a chair of the, still says interim, it's not interim, the executive board of CoFair, kind of overseeing the international CoFair organization. I'm a member of the SNOMED modeling advisory group, so I sometimes take SNOMED CT as examples, either because there's things I like or because there's things that surprise me there. And I'm a member of the Dutch Norm Committee on Health Information Exchange or Information Exchange in Healthcare. Quite some things that I will show relate to projects, funded projects that we're working on, Fair for Health, EJPRD, the Capable Project, and a Dutch project on COVID and mental health. You'll see that later on. So I'll go through quickly because I never want to impose on people that they exactly know the FAIR principles. And I've been in meetings where after 3 days people asked, so what are these FAIR principles exactly? Briefly go through them, talk about the interpretation and implementation considerations, routes to implement FAIR, the sharing and reuse of existing technologies, and the challenges to consider when approaching, FAIR-based solutions. So, FAIR guiding principles, and I think most of you will have seen them, break down into findability, accessibility, interoperability, and reusability. And as Matthijs said, it's about data and metadata, which I think is very important to be constantly aware of. And it's about human readability, and maybe even more so about machine readability. And I think the challenge is for us to contribute to establishing both data, the data and metadata, fairness, if you will, and machine and human readability. And I sometimes feel that fairness is fractal. When you zoom in, there's always more you can add. And I always say, if you have even the simplest data set with, I don't know, the people I want to write a Christmas card, suppose I do that in December, there's practically endless metadata I could add to that. Of course, their names, their email addresses, do digital cards then. The fact that this is actually a list of people I want to send a Christmas card, maybe how many times I sent those people a Christmas card, maybe the number of cards I got from each of them and in which years, and so on and so forth. So starting with a simple list, I can infinitely add metadata to that. And being able to represent all of that in I think especially in an interoperable way, which was one of the starting points. And I think basically establishing that in an interoperable fashion will be challenging. I would doubt whether Christmas cards can be found in ontologies. So I'll challenge you to find those. If at any point you are distracted during this meeting, find an ID for Christmas cards for me and post it in the chat. So I think there's, and that's not just for Christmas cards, that's also in healthcare. And I think many of the objective things have been established, like procedures, like diagnoses, but the maybe more subjective side, like patient complaints, findings, patient-reported outcome measures, maybe, that's definitely areas where current semantic resources are not yet sufficiently or fully adequate to be able to, well, be fair easily. So making your data and your metadata fair may bring you into having to develop ontologies in order to be able to adequately provide those globally unique and persistent identifiers to all the information you're capturing. So, well, this is at a high level, you see the 4 letters and you see some of the sub-principles that are specified within each of those FAIR principles. It's important to realize that FAIR principles is what and is not about how. So if I take, for example, the example of globally unique and persistent identifiers, I can provide 3 for myself, an ORCID. I was actually surprised to find that I had a Wikidata identifier. I think Wikidata harvested one of the publication resources, and they're populated for everyone identifiers, where I actually discovered that I am human. And also for LinkedIn, I have an identifier, and some of these point to or redirect to HTML pages. Well, with Wikidata, you can imagine that you also can get like an RDF serialization of the information. So the FAIR principles don't tell me what identifier to pick. They don't tell me whether it should be RDF actually or whether it could be something else. That's all to be decided when going, well, from principles to practice. And I think that all well relates to the 5-star linked open data. And of course, FAIR doesn't mean open, but it does mean that you have to think about, okay, how do I license my data? How do I structure my data? And what open format do I choose for my data to ensure that, provided that others get access, that they can handle the format, to make sure that your data is URI based. And if your data is URI based and your URIs are, I think we could say GUPRIs, globally unique, persistent, and resolvable identifiers, then we have actually also linked the data. So I think we can learn a lot in trying to take together the FAIR principles and the 5-star linked open data approach. And well, in this practice area, I'd like to look at, well, some recommendations and application areas. And the recommendations came from a few projects, and afterwards I'd like to address a few of those projects that we've been working on. And well, this is just the text that was in the invitation, so you may recognize that. This is what I'd like to go through with you. So first on interpretations and implementation considerations. So, well, there's a lot of, well, I put emphasis on reuse, but it's also important to realize, well, there's a bunch of things. I think there's always 3 things. You must want to do it, you must be allowed to do it, and you must be able to do it. And well, wanting to do it is the culture aspect. So, and I think, and hearing what you and your group are doing, well, I think this culture is developing, and this awareness towards the need for more open science is luckily sinking in. But that's very much needed to be able to really establish FAIR approaches. So we need the culture change. We need the awareness of people, well, that FAIR exists, what FAIR is, what FAIR isn't as well. And then contribute to implementation. And for implementation, there's always the challenge of balancing between being ambitious and being realistic. And I put up the go change, go train, go build, that which are the pillars in Go Fair. So Go Change is really about culture. Go Train is, well, basically from awareness to acquiring the skills needed to make your data sets fair and work in a fair way. And Go Build is all about implementation. And the important thing, I pointed it out already, we need shared resources and we need support for filtering and for selection. That's where AI and natural language processing come in. So if I look for blood pressure and I find matches in 33 ontologies, well, it's easy to get lost. So we need to support data stewards in fulfilling such tasks. And actually, if possible, we need to support them in doing that right from the start. I'm pointing here at the paper Martijn Kersloot from within my group has published on the de novo verification via an electronic data capture system. Because, well, the sooner you do your verification work, the easier it may be. And if you start developing your data dictionary or your code book, however you want to call it, in isolation, then you will find that you will have a very hard time to link it to existing standards. And actually the paper by Carlijn Groene basically has a different perspective, or takes a different perspective, but with the same approach to get towards this verification from the start. And both of them relate to the work we're doing in the European Joint Programme on Rare Diseases. So that's some very high-level recommendations, and I briefly want to go through a couple of projects that we're involved in to, well, shed some light on what these projects are and see what fair challenges and solutions have come from those projects. So there's the European Joint Programme Rare Diseases, a personal genetic locker project, Fair for Health, Fire for Fair Community, the Capable project, Dutch project in COVID and mental health, and work we're doing on fair ICU data. So all of these are addressing different aspects of fair. The European Joint Programme on Rare Diseases is a, well, large, if not a humongous European program involving 130 institutions from 35 countries. That also includes Canada, by the way. And the important thing is that it also includes all 24 European reference networks. I heard already mentioned in Matthijs' introduction the rare disease use case. And indeed, for rare diseases, being able to bring together and share your data is, well, indispensable, because no group, no center has enough information to be able to really learn from those data. So, because, well, in many places there are 1, 2, maybe 5 patient cases, especially for the ultra rare diseases. So we need to work together, and basically the European reference networks are trying to establish exactly that for example, rare bone diseases, rare cancers, rare neurological disorders, rare heart diseases. There are these reference networks in which centers of excellence collaborate, define their data collections, and try to, as much as possible, well, bring their data together in European registries. And in the European Joint Programme, we aim to create a ecosystem to basically support those reference networks, the European registries on rare diseases that exist, to establish practically a learning healthcare system where really the observational data, the real world data collected today can be used for analysis to improve tomorrow's healthcare. And the way we intend to do that, and we're to 3 years on our way now, we are developing a so-called virtual platform for, well, I call it now collaborative data use, because data sharing sounds like you're sending data around, but actually also in this virtual platform, it's much more the data visiting approach. Like, for example, also the personal health train promotes. So we want to be able to have this virtual platform as a hub where the data resides in the spokes, but we can ask queries, questions, machine readable to this virtual platform, and then this virtual platform basically delegates the question to the individual registries and collects and aggregates the answer. And there's a whole bunch of challenges with that. And one of those challenges is the use of many standards. I think there's also the challenge of standards not being used. There is the challenge of bringing that together in a federated infrastructure. And well, I know in Maastricht there's also quite some work going on in that regard. And I think one of the strengths of the approach that we took in the European Joint Programme Rare Diseases is working with so-called verification stewards. So we have a group of 5 people who collaboratively work on supporting the 24 European reference networks to make their data fair. So to sit down with them and say, okay, can you share with me your data dictionary? Can we look through it? Can we see to what extent it is already harmonized or annotated with existing standards? Is there overlap between the types of information that you are collecting and the types of information being collected at other ERNs? Because that means we have well, common data elements, and then the data elements common in the realm of rare diseases. So ultimately, what we try to establish is that those registries can hook up to the virtual platform with their data being made fair, and well, possibly also enabling other resources like biobanks to tap into that. And I think one of the challenges, well, I start with the use of many standards. We can't tell the whole world, and when we don't want to tell the whole world, of course, thou shalt use, well, whichever standard X or Y. So we have to try and deal with at least a subset of standards. And then you can think of CDISC, where we have data coming from clinical trials. We have OMOP CDM, the Odyssey common data model. There may be data exchange using HL7 FHIR. And we want to bring those together. So what we're working on is establishing a joint common infrastructure that enables basically communication through such a smaller subset of standards to exchange information with the various registries. And when I said talking about the data dictionary or the code book, it's also the specification of the metadata. So what exactly defines a data set from a certain European reference network. And all of this work, I think, is now really converging towards this virtual platform that we are putting together. One, well, not really a spin-off, maybe from my perspective, it's kind of a spin-off. It's a project, personal genetic locker project, which is run in Leiden, at Leiden University Medical Center, in which we participate, relates to rare diseases, because this is about the genetic passports, also important for rare disease patients, where the idea is to develop personal genetic lockers in which the genetic passports of patients can be stored and which can then be made available, for example, to find best matching medication. So this is something which is definitely, well, wanting to become fair, but certainly not wanting to become open, but having your fair data stations where you can visit to interact among proposed medications and the genetic passport to see if there's any relationship with that that can help in proposing the most adequate medication for a patient. And for this, we're currently in the phase of specifying an infrastructure, also looking into HL7 FHIR as the standards to be applied for the exchange of information. The Fair for Health project, I already showed now in the bottom right, the workflow defined there. Is a project in which, apart from that workflow, we established also 2 tools to support verification. One tool, and those tools both have a focus on, again, HL7 FHIR. One tool to do an extract, transform, load from relational databases and spreadsheets, where you can create a mapping from that representation to HL7 FHIR representation. Having user-defined transformations, and then be able to load your resources into a FHIR repository. And once it's in the FHIR repository, you can apply the data privacy tool to do de-identification and anonymization, so that you will get a de-identified, anonymized version of your data in your FHIR repository. And also part of, well, a related project within Fair for Health is FHIR for Fair. HL7 FHIR was established, well, maybe slightly earlier than the FAIR principles were specified, but they are realizing that, well, it's important to see how communication through HL7 FHIR can be as much as possible aligned with FAIR principles. So what they're trying to establish is to bring together both communities so that there's maximum benefit of the use of the FHIR principles, the FHIR, well, tools, softwares, and resources, and the FAIR principles.
Ronald,
Yes.
I have a question on this. So I think the FHIR and FAIR is a good example of where the line between, let's say, clinical care, observational data, and research blurs a bit. With regards to enforcing or creating measures to make the data more fair, Horizon 2020 is on a way. They demand that the data in research data management, they demand that the data becomes fair. Do you think we need more top-down measures in clinical practice to make data more interoperable?
I think that's an excellent question. What I feel that it's often asked, so, okay, make your data fair. So, which would have to mean make your data adhere to the FAIR principles. And that is like, okay, establish world peace. And I think everybody would want to have world peace. And for some reason, it still isn't there. Because everybody wants world peace in a slightly different way, and they fight over it. And I think the same goes with FAIR principles. I think ultimately you would have to, you can say, okay, so you have to have rich metadata. Okay, can we agree on how rich is rich enough? So if I say my data is Dutch, is that rich enough? Or do you want to know how many patients I have from Amsterdam and how many patients from Maastricht? And like I say, fairness is fractal. You can drill as deep as you like. And I think ultimately, so I think right now we are in the awareness level. So it is for people to think, okay, it's not just enough to say, hey, I have this bunch of data, enjoy, or I have this bunch of data and no one can touch it. And I'm not even going to tell people that I have this data. So we're now in this really preliminary phase, I would say. But if, and now that we are, and I'll show a bit of that later, establish these somewhat fair resources, I think we will see that there is a need for increased fairness and for concrete specification of implementations of fairness. So not just adhering to fair principles, but applying fair practices. And they can be very concrete and they can differ from domain to domain. So it may be that they say, okay, if you have clinical data, you have to have a FHIR API. If you have observational data, you have to store it in an OMOP CDM repository. I'm not saying that should be the way it should go, but something like that would help, because now people, well, okay, make it fair, and well, just find out for yourself how to establish that. So I'll show a bit of that in the next few slides, I think. So actually, in another project, Capable, I think that brings together a little bit of, like you say, it's a nice bridge, the observational and the clinical data. So there we're developing a system for supporting cancer patients after treatment. And well, it's an interesting project because it addresses both renal cell cancer and melanoma, so two domains within cancer treatment. It's basically after immunotherapy, actually. There's the Netherlands and Italy as data providers in the project. And it's an infrastructure which needs to integrate EHR data, have physicians provide access to it, and brings a patient support app so that we can, well, keep track of and support patients in their daily life and in their mental health also. There we've chosen the OMOP CDM from Odyssey as a storage model, and we actually do the data exchange using HL7 FHIR. So we there combine both. And well, we gave quite some thought on how this contributes to this whole being fair, and from that emerged two deliverables, which are on the bottom of this slide, on the information architecture and functionality for a fair infrastructure. So here we try to, well, make it concrete. And this is an example of a Dutch project where indeed the Netherlands, Zon and Way, says, okay, you have to tell how you're making your data fair. This is, I think, a very relevant and interesting project on child and adolescent mental health in current corona times, in which we have a bunch of data sets, both from regular population and from mental health patients, children and adolescents, and want to see how they are doing, how they are striving through the pandemic. Of course, due to the nature of these data, we have to assess privacy and take that very, very much into account, and have to deal with all data protection and data management issues. Because they have collected data for a certain reason, we have to constantly be aware, okay, we want to be fair, but are we allowed to reuse the data given the reasons for which those data were collected? And that's actually a struggle we're having. And that's something that needs to be on top of mind if people start to collect data, that they think beyond their initial, maybe very limited use case. Well, we're working on some dashboarding there to provide visualizations. And for the Netherlands, we had to work on the metadata specification using the CEDAR workbench from Stanford, representing the metadata in the generic dataset metadata template. And actually, I think it's quite nice to see that if you fill that in, that actually those metadata can be extracted and shown on, in this case, the COVID initiatives webpage from Health.RI. So looking there, you can see the specific information about this project. And it's all maybe baby steps, but it is, I think, important, like I said, to get from awareness to skills building and really establishing these fair resources. And then last project, working on fair ICU data, both in a COVID context and generally for ICU patients, together with the Netherlands Intensive Care Evaluation Registry, NICE, that also runs at our department. And there we have the challenge of making data fair at the clinical source. So really talking to the hospitals, how they can make their source data fair. And from that establishing, for example, Odyssey-based research data warehouse, be able to exchange information with a registry using FHIR, and also well, exploring how to do federated analysis using the Odyssey tooling. So that's also really a data visiting approach. And I think Odyssey also is in part, well, FAIR avant la lettre. So what we're now currently planning is FAIR teaching. And well, you also being a university, happy to reach out to you and knowing that you're doing a lot of work in this area. We plan to develop some teaching based on the How to Be Fair with Your Data, which is the teaching and training handbook for higher education institution that was or is actually currently being put together by FAIR's Fair. I think it will be delivered before the end of this year. And that will provide input for developing FAIR, basically learning pathways in our medical informatics and health informatics programs, and maybe also beyond, for example, in the graduate school, because then also researchers need to learn about FAIR. And we want this to co-create this and share this with the FAIR community. So I really welcome you to have further interaction and discussion on this so that we can really collaborate on this and jointly benefit, so that it's not just education about FAIR, but also education in a fair way. So I come to the lessons learned.
I have a question.
Yeah.
Sorry. So at Maastricht University, some of us data stewards are also developing this FAIR trainings, but we also realize that there's a need for us to be trained. So my question was whether or not you've also thought about developing some sort of train the trainer, or if that's also included the training of us data stewards.
I think that's actually a great idea. That it needs to go through all the levels. So I can imagine that the handbook that I mentioned helps as kind of part of providing structure, but it's not, well, it's a handbook, so it's not a train the trainer yet. But I think it can be used for getting to a train the trainer who can then train the data stewards. So
yeah, and then also a follow-up question to that was, I always thought about like what's the governance structure that certifies us. So like if researchers are taking these trainings with us, how do I tell them, yeah, this is a good FAIR training? Who evaluates what's a good FAIR training? And
yeah, that's an excellent point. And actually, there is work going on in that area. And I'm thinking I think Eric Schultes from GoFair is involved in that. So and that's definitely something we would want to establish, because we want to make sure that, well, if we develop this, that it's, well, adequately acknowledged and, certified or accredited. Yeah, so I think these are very, very nice areas to follow up on. So lessons learned, well, not so much about accessibility, but, well, findability. I think we're, in spite of all the metadata we're specifying, we're still, it's still a challenge to really find data because the way in which metadata is specified, it's, I think, still limited and heterogeneous. So we still need to take steps on richer metadata, and we need to specify when rich is rich enough. I think there's a bunch of interoperability pitfalls. I see people creating ontologies like from scratch, which aren't really ontologies. So well, maybe not so nicely call these people non-ontologists. They basically sometimes create schemas and don't realize they create a schema and think they create an ontology. So that's also an area where we need to do further, well, training, or at least raising awareness. Well, post hoc verification is a pain. So if you can verify de novo, then you can really make a head start in your, especially interoperability. And well, there is a lot of heterogeneity, and there will be, but that is something that we need to address, and we need to see if and how we can provide mapping throughout. And as I pointed out, reuse of data is often hampered because, well, the data collection scope has been so narrow that it is very hard to be able or be allowed to share the data. Well, then in a practical approach, and especially I think what we learned from Capable, as much as possible separate the metadata from data because of their different nature. The metadata is generic, it's open, it's cross-domain. People need to find out whether it's of their interest. And well, you will never have someone outside of healthcare know how to work with HL7 Fire or OMOP CDM, for example. So don't wrap your metadata in there. Keep generic standards there. But then your data, of course, is domain specific. And maybe even more importantly or equally importantly, it's restricted. So your access conditions apply to data, not to metadata. Well, there's a whole bunch of tools that we need to address and that need to be integrated. And we need to work on the indexing of fair data points and the various flavors thereof. We can see Odyssey as fair data points. We can see HL7 Fire endpoints as kind of fair data points. And there's the fair data point specification, there's CEDAR, Workbench, all of that. Well, we need to be able to integrate and index those. So I think there's many pieces and we are really taking steps, but well, I think we still need to complete the puzzle. So, well, I think the principles are embraced globally, like the need for world peace, but as they are deliberately open, well, we need to get the fair practices sorted out and really stand on the shoulders of many, many giants who have specified standards before. But, well, while climbing on the shoulders of giants, I think we have to mind the gap of the things that we need to fill. And, well, we'll certainly fall down once in a while. And I think it's important, as I said, well, if we can apply fair practices from the start, that will really help in speeding up the process. So I want to thank my team who have helped in many, many of these projects and basically do the majority of the work. And Nicolette Friesta and Marco Roos from Leiden University Medical Center, as he's kind of a remote partner in crime in this. So there's a link with the literature sharing the slides. And thanks a lot.
Want to learn more about the open science movement and FAIR? Find our next events below.